This is Dr. Cruz at Kentuckiana Integrative Medicine, and we're interviewing Keith Perkins. Keith, is it all right if we put this on the internet and on our website?
I'd be happy to help.
Great. So tell us what brought you to Kentuckiana Integrative Medicine.
Well, what brought me here was when I was out of work and didn't have any money or insurance and was turned away from other facilities, and then decided to use some retirement funds to take the ketamine therapy, which was recommended to me by my older brother, who did the same thing. I didn't know anything about it until he mentioned it. We did a Google search and found your clinic here in the area, reached out, and it was about 2 years ago that I came here. I was miserable with major depressive disorder. I've taken multiple SSRIs in the past. I've had acute depression for decades. A lot part of my adult life. I've taken Effexor, Prozac, Wellbutrin. None of those really did anything for me. And that's what I was looking to go on at the time when I was turned away, so I had no choice. So you offered ketamine therapy, and I haven't heard of it. I really wasn't prepared for what I went through, but it was absolutely miraculous. Whereas SSRIs may take months to ramp up to be effective in somebody, the ketamine was literally overnight. Did 3 sessions one week, 3 sessions the following week, and then later on a follow-up session. And I dare say that I haven't felt better in decades. Since then, I've got a cancer diagnosis, I've had close friends pass away, and I'm not crippled like I used to be. I take it in stride, like life is normal to me now, and I've literally got my life back.
That's wonderful. So it's been 2 years since you did roughly
Yes.
your last ketamine dose, and
And
you are now employed, and you're a IT engineer, is that right?
Yes.
Okay.
And it literally still helps me today. My cancer diagnosis is fairly recent. Instead of being all worried and depressed and all, the normal type of negative response that somebody may get, I just like, it's something you got to deal with and treat and go along with. And I dare say that it's helped to this day.
Well, we are going to help you with your cancer diagnosis, and we appreciate you letting us do this interview. Thanks
you
so
very
much.
much.
You bet.